We're going to delve into this topic of heel pain a little bit further. We're going to talk about the stretching that we should do as part of a rehab for as part of the physical therapy program for the heel pain. Now, people coming with heel pain, the most common thing we see in the practice. So, what do? First of all, typically we will give you an injection or give you some non-steroidal anti-inflammatories, assuming that there's no rupture in the plantar fascia at the bottom of the heel, right about here. So basically, what is plantar fasciitis? A lot of people ask. Earlier in the video, in the other series, we spoke about what the plantar fascia is. The plantar fascia basically is almost like a rubber band tissue going from the heel onto the toes. Now, you see that inflamed tissue is nicely marked over there. That's exactly where people usually have the inflammation. What do we do with the injection? The injection is, most of the time, I would go in from the side because it's less painful. We deposit the medication right in here in the inflamed tissue. That will help to bring down inflammation and start the healing process. Some doctors will go from the bottom. That's very dependent on your individual physician, which approach they want to do. Now, the plantar fascia, again, is this tissue going from the heel bone out into the toes. When people get plantar fasciitis, it can get inflamed here, or it can get inflamed in the arch. So both areas either place can get inflamed. So again, this is the most common. Sometimes people get it inflamed in the arch. Now we're going to show with our foot model. We're going to take a look right here. Our foot model right here today. We see this plantar fascia right here. This is going from the heel all the way to the toe. Same as that foot model that I showed you. But this is on a real live person. This is what the plantar fascia looks like. So you pull back the toes and you see this rubbery substance on the bottom of the foot. You can run your hand through it. You can run your knuckle through it. That's the plantar fascia. The inflammation sometimes is here, but most of the time it's here where it inserts into the heel. So what do? Well, let's go over our first stretch. You get a towel or a belt. We're going to follow this. Take it from one side to another and pull. Okay, you can pull on the arch. You do 3 sets of 10. Relax. We're going to go up here on the ball of the feet and now pull again. Pull all the way back, no resistance. You want to pull back. Relax your Achilles tendon. Relax your Achilles tendon and pull. You want to pull that back. You want to stretch the Achilles tendon. That's what that stretch is for. You want to stretch it. Okay. Again, 3 sets of 10. Now we're going to move ahead. Next part. We're going to cross your legs over. You're going to pull back on your big toe. And you see that you're emphasizing this tissue right here. Now, relax your Achilles tendon again. Okay, here's what you need to do. Now, remember, this Achilles tendon is continuous with the bottom of the foot here, the plantar fascia. This one continuous tissue anatomically. So you do want to stretch out this Achilles tendon, and you want to stretch out the structure on the bottom of the foot. So, if you can con somebody to massage this for you, get some cream, you pull your toes back and have someone just massage it really deep for you. Stretch that tissue out. Do that for about a good 10 minutes, or you do it yourself. You pull back the toe, and again you get your hand in there and you stretch that tissue out. That's stretching number 2. Okay, now we're going to do the calf stretch. Go ahead, let's start the calf stretching. Okay, bend your front knee. You want to get the heel to the ground. The heel to the ground, and you want to stretch. Now, a little trick to this stretching strategy is point your toes in. Point your toes in when you do it. That's going to strengthen, that's going to cause you to stretch your Achilles tendon more. Now, if you point your toes out toward the outside, here's a problem. Now stretch. You see the arch is flattening. So you're really flattening out that arch when you point your toes out. You do not want to do that. You want to stretch that Achilles. So you want to go ahead and bring your toes in and stretch. Now another trick. Now you're going to notice, we're going to do another stretch. Now, that's stretching out your calf muscle. Now, there's 2 muscles here. There's a gastrocnemius, and then there's a soleus muscle. Soleus is on the inside. Soleus does not cross the knee joint. The gastrocnemius crosses the knee joint. So, basically, when you're doing this stretch, you're only stretching one out of the 2 muscles. So, what you want to do is now you're going to bend this knee and sit back. And sit back towards me. Right here. Come back. Right there, and stretch your knee right there, bend your knee, right there. When you bend your knee and stretch, you're stretching out that soleus muscle. So those are the two different stretches that that you definitely should do. Again, 3 sets of 10. Let's switch. Let's do that again. Now, a lot of people do, when they stretch it the wrong way. We need to turn that foot in and stretch. Okay, very good. Okay, here we go. This is called a night splint. This is a splint that we put on the patient. This will help with the pain, first step in the morning of getting out of a car, or first step getting out of a chair. That's usually a patient's complaint. Scientifically, it's called post-static dyskinesia, pain after you've been in a static position for a long time. Basically what happens, that plantar fascia contracts, and when you first take that first step, it gives you an ouch. When you take that first step, your foot is here, and you take the first step, ouch, you sprain that plantar fascia. So what this does, it keeps the foot in a stretch position so you don't have that acute stretch upon the first step. The goal of this is not to give you a hyper stretch, but really the goal of this is to hold your foot in about 90 degrees. So that way, when you're sleeping or resting, the foot does not drop like the other foot over there, and the plantar fascia contracts. That's where the pain comes from that first step in the morning. Okay, now we're back. This is the last and final stretch here. That's going to help you with your heel pain. Go ahead. This is a foot rocker. You go ahead and put your heel on there, and you just sit back and relax, but don't fall. Stretch, stretch, stretch all the way back. This will stretch out your Achilles tendon. Again, the Achilles is attached to the plantar fascia. You want to go ahead and give a nice stretch right there. Again, you do this for about 5 or 10 minutes, alternating between legs, or do it for a few seconds, stop, do it for a few seconds, stop, and this will help stretch out your calves.
Right.
Next part of the stretching is the using of a foot roller. Now we have a foot roller here that's commercially available. You could put this in the freezer. It's made by a company called TheraBand. You could put this in the freezer, it won't get wet and it won't slip and it won't distort. You go ahead, you put it underneath the foot here, and go ahead. We're gonna have her roll her foot back and forth, sort of a foot massage. This helps to stretch out that plantar fascia, the band of tissue on the bottom of the foot. Again, we're gonna continue doing that for about a good 5 to 10 minutes. This is essentially what is happening. If I take her foot off of there, we're gonna do this. If you can imagine this, we are stretching out this plantar fascia with this foot roller.